Hello, here's Clara Mavelia of the Cultural Entrepreneurship Institute Berlin. Today my guest is Dr. Maja Hofmann. That's why we are at the Charité. She is a fabulous dermatologist and I'm looking forward to hear more about her work and ethics and beauty. Welcome to our community, Frau Dr. Hofmann. Frau Dr. Hofmann, guten Tag.
Dr. Hoffmann, good morning. Welcome to you.
Sie sind sehr beliebt. Sie machen viele gute
You're very popular. You do a lot of good things. We've heard about that. That's why we've come to see you, because we want to hear about the particularly good things for our channel.
Ich wollte Sie fragen, was machen Sie?
So I wanted to ask you, what is this special thing you do with people? I'm a dermatologist, a skin doctor by profession, and I've specialized in aesthetic, cosmetic matters, laser, technology, but also normal skin disorders. I think the special thing is that you're able to put yourself in the patient's place. Of course you can look at a person from the outside, but every individual has their own concern, their own individuality. If you're considering cosmetic issues, you have to particularly take care that you know whether it's a cosmetic issue or whether there's some other reason. So if we stay with you, what influenced you? What made you the person that you are? First of all, my family, my upbringing. I think families have a big influence in imparting values, being honest, responding to people, looking after things. That's important in medicine. Perhaps women are better at that than men, this empathy, this ability to understand others. But it's very much influenced by your social environment. So what was decisive in making you what you are? You have to be determined. You need to be ambitious enough to complete your studies, survive all those exams. I've taught students myself, and when you look at those young people who are really stressed, who have so many tests, so many exams to get through, you have to be really determined about your aim. And I enjoyed medicine. I have enjoyed my profession. Then you can decide at a certain point which specialization you want. And I thought skin was really interesting because you can see skin. You can see what's happening. Whereas in internal medicine, you have to do a lot of tests first. But the skin is the biggest organ that we have as human beings. That's why it's so exciting. Do you have a philosophy of life? My philosophy of life is to impart what I think. I try to put it across to the patients, or I try to understand their perspective. This honesty, so that you have an appropriate consultation. How do you combine your family and professional life? That's always difficult. And it's increasingly difficult, especially if you work in medicine today. Of course, you want to have time with your children, with your family. And it's getting harder and harder. But I think Berlin is a fantastic location in terms of childcare, including for small children. I know other countries have that, enabling women to return to work quite early on so that you don't take too long a break and fail to catch the train again in your profession. It's difficult when your child is small, when children are ill a lot, to be reintegrated into your workplace and to have an employer who understands. And what fascinates you about the Charité? The Charité has a long history. We have a lot of famous personalities who've worked here. It's fantastic to work in an environment like that, where you know that it's one of the leading hospitals in the world, and you have this opportunity to work here. It's fantastic. You have the students, you have the environment. The work is enjoyable, and there's a lot to do, though. Tell us how such a huge institution functions. How complex is your function? Yes, I sometimes wonder myself how it all works. It's such a big institution that sometimes one wonders, how does it all hang together? But it does function. The small teams have to function. The team has to work as a small unit, and then that spreads out. If the small team works, then it works. If you can rely on each other, and you know, in my immediate environment, the people I work with, I can rely on. You have this huge administrative apparatus, this huge network at the Charité, and that makes it difficult. Of course, there are lots of things we can improve there, but that's normal in a big workplace. What about your work as a consultant? Can you describe that? Yes, of course, I have my own consulting hours, my own surgery where you can discuss difficult problems. And of course, you have junior doctors who've just finished studying that you have to supervise, make sure, teach them things, make sure they're able to work independently with their patients, and make some input with the experience that one has so that you can help your younger colleague. Well, to give us a proper idea, can you tell us about your working day? Well, of course, I always arrive in fluff because I've just brought my children to the kindergarten. If you know they're being well looked after for the day and they're not ill, then it's quite a relaxed day. Then I begin with my normal surgery hours. Before that, there's usually a bit of red tape to sort out. Telephone calls you have to respond to, talk to other colleagues. Then I have my surgery. Usually it's just a normal dermatological clinic. On difficult, or some days I have a laser clinic as well. Sometimes I also have laser consultancy where I am the consultant, but there are junior doctors involved, and I basically supervise what they're doing. Then there are other days where I focus on aesthetic matters, for example, Botox, filler. Sometimes we have a mini-op. So it's very diverse. And in addition to that, of course, you've got the students. Because we're a teaching hospital, we have to teach during the semester. We want the students to enjoy what they're learning. That's important. Sometimes you have to give a lecture. That's always on top of the other things. You do that really rather behind the wings, not when you're sitting at your desk in your surgery. It's university study here, and then we have to try and do our research as best we can in our free time. It's often very difficult to combine that all. I can imagine. What untapped potential do you think there is there? If we could spend more time on different aspects of research, we don't have the time, we don't have the money. You have to apply for the money, which means you have to fill in research applications. Often we simply don't have the staff to do that because, first of all, we want to look after our patients. And then the research has to be done in our own free time. I think there's a lot of untapped potential there that could be better structured. Why is research important? Research is important, as we all know. If we have a new drug on the market or a new cream that's now in the market and we want to research whether it's really of any value to us. If we only do the laser tests or the laser technology and we don't know what's actually happening to the skin afterwards, we'd like to know how to improve the laser, how to avoid the scabbing, for example. Or perhaps to reduce the intervention, to minimize it, to do more cancer research, to do more research into cosmetic aspects. It's all important to make progress and to help the patients more effectively. You've achieved so much already. What opportunities do you see now in terms of the time you spend traveling, the time you spend on your patients, in order to make your values really play a part in your work, in terms of the environment, in terms of protecting the environment and resources? So I think there's a lot we can still achieve. You mentioned protecting the environment. There's a lot we can improve in the hospital as well. For example, we have a lot of waste arising. These are things you're not really aware of as a doctor. The amount of waste that we generate every day and how we could improve on that. The Charité, for a long time, it was difficult to reach from other parts of the city. Now we've got a new tram route, which means that it's easier to get here by public transport, which I think is important. Those are things we can improve on. What's important to me is that you can pass on your experience to younger colleagues. That's rather a nice aspect of working in a teaching hospital, that you have a lot of young colleagues and you can effectively work with them and teach them how to deal in a friendly way with patients. Yes, that's important, and perhaps we could say that it's a bit of a dilemma. How do you think that can be resolved? Effective organisation, teaching, research, care for patients, and nevertheless care for the environment. Yes, of course. The main problem, I think, at the moment is that hospitals don't have to make a lot of profit. They should be making sure they're looking after the patients properly. Everyone wants to be looked after properly if they're a patient. That's what we pay our health insurance for, or our tax or whatever. I think that's important. If we've got a grip on that and we know that our patients are properly looked after, then we can start doing the research and work on the other aspects. But these things should really work hand in glove. In such a big workplace, that's often very difficult. We have cost pressures. Very often we have staffing problems. We don't have enough staffing, enough doctors. And that's the main problem, really, that the resources you have, the money, we're spending it at the moment on modernization. We have to do that, but a lot of money is being invested. We had a patient from the former GDR standing at the window here and saying, looks exactly like it used to 50 years ago. And there's a lot of old junk here, isn't there, inside and outside? And I thought, actually, that's right. But of course, it's really expensive because this hasn't been done for decades. It's interesting that you mention that because you have very diverse people, don't you, in a hospital? Yes, especially among your patients. You really have to address each patient in a different way. Each patient has a different background, a different reason for being there. And we all have our different experiences from childhood onwards. Some people are really fit when they're elderly. But all of us have our own personality, and I think that's fantastic about medicine. We can't work on a standardized basis. We still have companies who say you have to standardize patients. You can't standardize patients. People are individual, and I think it's often like that in surgery. You can't say every patient can be dealt with in 15 minutes. Some people need a bit longer. Some people you can deal with a bit less time, and you can't depend on the telephone. That's why there are queues, why people have to wait. Some people don't understand it. They say, I had an appointment at 10, how come I wasn't seen at 10? But in medicine, that's a bit of a problem, and you have to take it seriously. Of course. And what can you do to enthuse patients about the work that is being done in the hospital, including things like what they eat, diet? Often people's diets aren't that good, not so healthy. I went to a hospital once and they gave me a sausage to eat for lunch. What would you do if you had more power or more impact? That really is an important point. I think that is something I can talk about. If I had the chance to score the Charité, I'd give them a low mark for that. I think it's awful for patients, but also for staff. At the moment, we don't have a proper canteen. You can go out and buy something, but you can't have a proper lunch. And if you're on duty for 24 hours, sometimes you don't know how to deal with that. So, of course, food for patients should be a lot more varied, a lot more healthy. I think that's decisive, especially in a hospital. If everything else is running badly, at least the food should be right. Sometimes you don't find out about it in good time either. It's really a problem that is rather difficult to resolve for such a large operation as we are. Good job you mentioned it. Okay, well, if we talk a little bit about the medical side of your work, we've heard that prevention is the area where most savings can be made. What does that mean in terms of dermatology? Well, we could put it this way. If we want to work very preventively, we really can save a lot of money. We can detect tumours a lot earlier. That would save patients from getting metastasis. You can't entirely prevent it, but you can say, okay, if we can identify, detect earlier in the process, then it's a lot better for the health system, apart from the patient. And that's why prevention is very important. So if we look, for example, at cancer of the intestine, we've seen that you can save a lot of money. Does that mean in dermatology, for example, that anything irregular should be removed? No. That's why you have a specialist skin doctor. You have a specialist surgery. From 35 onwards in Germany, if you are insured, you can have a check every 2 years. And then the skin doctor will decide, does this need to be removed or can we give it a chance to develop, see what happens? That's why we have specialists. That's what we do. It helps us to detect cancer early and to come up with appropriate treatment. How important is diet for our skin? A lot of talk goes on about that. We know that a balanced diet is very important. Vitamin D is really in fashion at the moment because there have been some new studies, and we know that vitamin D plays a protective role in many kinds of cancer. So skin doctors say, okay, well, for that you need ultraviolet light, i.e. sunshine, for vitamin D, and people need an adequate dose of it, which means that in winter a little bit of vitamin D is necessary. That requires a healthy diet. We can see that we need a lot of vitamins, and if we make sure we detox, that's very important for the skin. What about regular care and diet? Can that prevent aging or slow it down? Of course, if you care for your skin, we know that wrinkles don't form so quickly. We can delay the process. Genetics play an important part, and so does ultraviolet light. We have older people who may get wrinkles quite early. We're out in the sunshine a great deal. It can be a problem. If we know early enough what factors play a part, for example, excessive sunbathing is a problem. A very topical issue is that we have a new EU regulation, sorry, we just had the ambulance, which says that cosmetic packaging must say exactly what contents, what substances are contained in the product. Yes, that's very good for doctors and for patients, because we have a lot of patients developing allergies. And if you buy a cream, you need to know exactly what's in it, because there are a lot of different substances in such a cream. And if you have an allergic patient responding to just one substance, it's very important that we read everything and find out whether that substance is in the preparation. There have been creams where it hasn't been declared. You put it on someone with a skin allergy and you have a problem. So it is important to declare on the packaging what exactly is in the creams. Apart from cream, these days, it's pretty common to use aesthetic operations. What do you think about that? I think there's a time for everything. That's very important. You can achieve a certain amount with that. You can get good results. But I think there's a trend for younger and younger patients to come along where there's not a lot you can do, and where you shouldn't start using Botox or filler preventively. And my concern is to tell that to patients. I often send them home again. If I get the feeling that we're not going to achieve anything with this intervention. Something else I think is important is that we want to see older people. Why on television do we only see youth? Our society is aging, and I think it's a bit of a trend which is not a very good thing. Everyone's supposed to be wrinkle-free. There's nothing more wonderful than to see a beautiful old woman with life showing in her face. Everyone having a Barbie doll face, I think, is a terrible development. It's a trend we have, and I don't like it. I think a face should make sense. I don't want someone to come along who's achieved a certain age and has a lot of wrinkles, and they simply want one part of the face treated. You have to see the face as a whole. Injecting Botox in one part of it isn't going to achieve much. We need to look at people's age. We need to look at little details we can perhaps work with. That's very interesting. That's why I wanted to hear it very clearly from you. Is beauty a matter of age? We know it isn't, but it's often defined that way, and women often define it that way. We really have to say, and it's not very nice. I think an individual face is much nicer than a Botoxed, facelifted face. It simply isn't beautiful, but it's a trend that we're witnessing increasingly, and I don't know where it's going to lead us. But for the layperson, Botox is basically an awful poison, isn't it? Yes, it's a nerve poison. So how can it be injected without negative side effects? Yes, it is toxic for the nerves, but we offer very, very tiny doses, really minimum doses, so that we only have a local impact on the muscles. The muscle is paralyzed, which smooths out the wrinkle, and it can be done over several years. In America, they often do it for longer, and they use it during neurological disorders as well. And we know that there are almost no side effects. So we can tolerate it. Yes, we can, but we shouldn't start too early with it. There are patients that develop antibodies and then the Botox has no effect any longer. You shouldn't start at 20 injecting Botox. You should perhaps wait when you get those little wrinkles, that angry frown. That you can treat quite well, but it has to be appropriate. To what extent might psychological factors play a role with skin disorders? Yes, stress is of course the biggest factor. We hear a lot about it, but we don't have any really good studies on the fact. There are disorders where we know that stress plays a very negative role, exacerbates the disorder, and of course we know when we get exam stress, we get spots or we get herpes. That does play a part, and everybody processes their stress differently. But of course we say in German that the skin is the mirror of the soul. It's often the case. If you're stressed, we can see this in our skin. If we sleep badly, we can see it in the skin. I have a question which is perhaps rather different. I'm rather surprised that people are the only species that blush. Do you have an explanation? That's a good question. It's got something to do with the fact that a long time ago, in the days when we were hunters and gatherers, we used to have a rush of adrenaline so that the blood flowed better through our body. Our cardiovascular process is centralized, and we want to run quickly if there's a danger. When we're stressed, sometimes it can be too strong a reaction and we get a heart attack. But basically the idea is in a stress situation the body needs more blood, which enables us to run faster and escape the animals that are after us. So the fact that we go red is perhaps inappropriate now culturally. The question is what we do with this with evolution. Does that mean we're going to get people that don't get heart attacks any longer and don't blush because it doesn't suit our lifestyle? I don't know. It's an interesting question. Yes, which species will survive? Well, thank you. We've heard a lot of interesting things from you. Very inspiring. Now I would like to ask a few questions aimed at inspiring our users. These things that you've talked about, what's the most important to you? I think the most important thing is that people are individual and aging is individual. And an aging skin can be beautiful. We need to respect that, and we should respect it in the media. That's my main message, I'd say. And what would you like to see in the future? In the future, what I would like to see is for people to live together sociably, that we respect one another, and that we do a lot of research, not only on skin cancer, but also on aesthetic research, to find out how the skin does age. What are the main factors in that? Why do some skins age earlier and others later? Why do people get wrinkles? What do we know about these biological processes? And what would you like to tell aspiring doctors? You need a lot of energy, but you need a lot of motivation too. It's an old saying, but I think it's true. It is a vocation. You need to enjoy it. I certainly did. And if you do dermatology, if some people say, oh no, I don't want to work with skin, then don't work with skin. I think that's really important. It's very important to me, the skin. And perhaps if other people say that's not the right way for me, that's fine. We need to follow our goal, and that will lead to success. So what is really important in life? I think to have an internal balance, to be satisfied, contented in yourself. And if you can do that, you don't often hear it, a lot of people never achieve it. But if you do, you can pass it on. Then you're relaxed about your own life, you're relaxed with the people around you. How important is sleep? Last question. Sleep is really important. That's why we all know, don't we, that stress leads us to sleep disorders. We all know from our exams how badly we sleep around exams because of the stress factors that have been unleashed in the body. And there are processes going on we're not necessarily aware of. The older we get, the less sleep we need and the less sleep disorders we have. We'd all love, like children, just to lie down and sleep till the morning. But as adults, we don't always manage that completely. And so it's really important to get a grip on our stress factors, to be aware of them, to know what is bad for us and what is good for us, so that we can respond accordingly. So what's your next project? The next project is that we've got some new equipment from America to rejuvenate the skin, but also to treat wrinkles and also to treat scars. We want to know what's happening to the skin during these processes. We want to know what happens under the skin, and this equipment will help us to see that. We want to have a look at this. Thank you very much, Dr. Hofmann, for that fantastic interview.